Okay. So my name is Jillian Molares, and I'm in the class of 2022 at the University of Minnesota Medical School. And today we're here with Sherry Shannon, who's a volunteer with Street Voices for Change. We're going to be talking about homelessness as part of the Twin Cities Medical Society's Community Conversation Series. So welcome, Sherry, and thank you so much for being here.
All right, thank you.
Yeah. Can you tell me a little bit about Street Voices and how you got involved?
Well, Street Voices is a group that we come together. We had four groups, but with the virus thing, we are down to just one right now. But we're trying to open it back up. But Street Voice is a group where people that experience homelessness or who are current homelessness or people who have worked with homeless comes together, and we have a space where people that's homeless can have a voice. And when they're in that space, they do you do hear their voices, and that's what this is all about. And what it is, we just try to change some of the things that's keeping people homeless. And like for one, it's like affordable housing, and the other main thing is low barriers. People can't get into apartments and all that because of low barriers, because everybody has something on their record. I shouldn't say everybody, but mostly people that experience homelessness have something on their record or their credit or something. They're not making enough money or what have you. These are barriers that's stopping people getting into these affordable housing. And so that's what we do, and other things like our Street Voice Bill of Rights bill. We're working on that. So that's one of the main things, and some of the things. And also, I want to let you know I'm with Envision Community. That's a tiny house. That's why we wanted a part of the Envision, because this is going to be units up for people we're going to have low barriers. So people can afford to move in, or so if they have a criminal background or what have you, they can be able to afford to move in one of these units.
Yeah, that's awesome. It sounds like there's a lot of really good projects going on. How did you get involved with Street Voices?
Well, the way I got involved with Street Voices is because, like I said, I experienced homeless myself. And because I've been through it and I know what it's like, this is my way of reaching out to others. And plus, I always been going out in a community, helping people, like through ICCM Life Center. I just go out on Friday nights over there on Broadway and Lindale, pray for people, meals and clothing. And so when I was doing that, I feel the connection that people reach out to me. They feel comfortable talking to me. And I said, well, if that's the case, then that way I can help them. And then plus mainly it bring a person experienced homeless to the table, because you can't change something that you don't know nothing about. So by bringing people that's homeless or experience homelessness, you have a better outcome.
Yeah, I think that's a really powerful point that you're making, Sherry, about how are other people supposed to connect with people experiencing homelessness when there's a disconnect of, I've never experienced that before and I don't know what they're going through. So I think that's a really great point. So you mentioned
the thing to go with that is trust, because homeless people, we trust each other. And they'll come to us, and for example, because we're out there and we know where basically everything is at. So like, for example, if you happen to get homeless and you don't know where, you say, well, Sherry, can you tell me where such at? Oh yeah, we can show you exactly where to go, because everybody knows where to go, because that's how the system is set up. There's only a certain area where you can go to get some help, or they either do it or they don't. And same thing with shelter. So
okay. Yeah. And you mentioned some of the barriers to securing safe housing. What are some of the biggest barriers that you feel like people are facing?
well, like I said, mainly is criminal records, background. Some people have been did this about over 10 years, some just 10 years, and they still come back to hunt them. Even child support, stuff like that. Even simple little thing, little tickets, parking tickets that they didn't pay. Things like that. And then the other big barriers is when people that's do not have a job, don't have enough money, and the rent's so high.
Mhm.
And so how you gonna get into a place? Cause a lot of times, like when you go look for a place, you gotta have first, last, and plus deposit money right up front. Who has that? If you get 205 or 203, how are you gonna get that? That's every penny you got. That probably take you about a whole year, and then if that, because that little bit is really hard for people to live off of, anyways. So time then. So with that there, and then once they get in there, then you got to look at the utilities. So these are the things. These are some of the basis housing problems, and then most important of it, a lot of them don't want us. They know you're homeless, and a lot of time when you see homeless people, a lot of them are pulling their carts because they have a lot of stuff. Same thing with a job interview. Who's going to hire you if you're pulling these carts with all your belongings, or you ain't had a chance to have a shower, or you didn't get enough sleep, so you come in there tired, then they think you're intoxicated. So then some people have disability, medication, things like that. So these are the things that people judge us, and that's how it's hard for people to get in and afford any kind of house, affordable or not.
Yeah. It sounds like this endless cycle of like, you can't get housing unless you have a job, but you can't get a job because you can't get an interview if you're experiencing homelessness. And like you said, you can't have a shower and everything like that. So it's like, where is the entry point for these people,
Right. Even with job, you can have a job. A lot of us working 2 or 3 jobs and you're still barely making it.
Yeah.
Because every year, once you get in a unit, every year they want to raise your rent, and then you're right back out.
Yeah.
Okay. And then like I said, a lot of people, they don't have cell phones as we speak of today, because like I said, who can afford to pay a phone bill? And then with the Obama phone, yeah, that's good. But at the same time, they give you so many minutes, time they put you on hold for a long period of time just to talk to a worker. You don't have no more minutes left. So who else can you call? Then they said, well, you got to call back such. So then you call back, they put you on hold. And then it's like, and then all it is just making people more frustrated.
Yeah. I can't even imagine. Yeah. So what would you say safe housing looks like for you or other people that you've worked with?
Well, safe housing for me is that I feel comfortable in my home. I feel I can go in and out when I please. There's no time limit. There's no certain time you have to eat. You can eat whenever you want. Same thing with your sleeping. And then the other thing is you have that space that you need. Everybody needs space. When you're in shelters, you're so clammed up next to each other. Then you leave, and then you're still around people, because that's where homeless people go, because there's nowhere to go. Mm-hmm. Okay, so but yeah, the safe house that I'm in, it's affordable for me. I can pay my rent. I don't have to worry about paying it this month. Next month, I got to try to look for another place, or if I'm going to be homeless again. And then the most important is it's a community. I like to get to know my neighbors and stuff like that. Actually, I had a barbecue when I had moved in here. That's how I got to meet my neighbors out here. And then most important, being part of the Aon, that's where I'm renting from. They're members, they have different things going on, be involved in different activities that they have. And then once you get to know your neighbors, you feel safe because you look out for each other and everybody knows who you are and stuff like that.
Yeah. Well, it sounds like you're in a really good environment right now, and I'm happy for you for that.
Mm-hmm.
Yeah. So you mentioned that you're involved with Street Voices with the Envision Project. Who do you feel like have been your biggest advocates and partners in the process of working towards more accessible housing, both for you and for the community as a whole?
First of all, because I have God in my life. God leads me, and because He helped me get through some of these things that I was challenging. And then the other thing is Central Lutheran, the Central Lutheran Church. Because when I used to go there to go eat a meal, that's how I got involved with Street Voices, and that's how I knew about Envision. And then plus Street Songs. Street Song is a choir we put together that for homeless people who experience homeless or who are homeless or work with homeless. We call it Street Song of Minneapolis. So these are the places, and then there's a lot more than Hennepin Methodist Church, because I'm over there, and I got a good support team there that helps me, and different groups. The Dignity Center, I did a presentation on that, but they helped me reach my goals. I've been going there. They got different little workshops. You meet with a caseworker, and then you set goals for yourself. And that's what plays a big part if you have a place called home. It's hard for you to work on your goals when you ain't got no place. And so that's what really helped me through the Dignity Center and just having the support. And then there's other organization. And just to let you know, I have won the Dorothy Richardson Award, and that was through Aon because they nominated me. It's a national award. And I was really blessed because I didn't think I would win something like that because, I was like, who wants to have me do this? Because, that's what you go through when you experience homelessness. You be wondering who, me? You don't expect that. And it was a big thing for me. And like I said, some of the people recognized me when I was there from 10 years, and because I get that connection.
I think it's so important to have that recognition and that affirmation. And I'm so happy that it sounds like you make a lot of connections and are really involved in the community. And it sounds like it was a very well-deserved award. So congratulations.
Well, one of the reasons is because I'm one of the leaders in the Street Voices. I facilitate one of our groups. And then when you do that, people listen to you. And then I always speak on my experience. Yeah. And so then, I give people hope. And then I was been doing this when I was with ICCM Life Center. But I volunteered to drive a van to pick people up to bring to church. That church helped me a lot too. It's just a lot of the congregations I'm involved with.
Yeah, it sounds like you've created a really big network, which is awesome. So we'll be sharing our conversation with physicians and medical students across the whole state of Minnesota. What do you think that physicians, med students, and healthcare professionals can do to support the work that you're doing?
Well, one, I would just say that when you're doing the type of work I'm doing, you got to keep an open mind. You got to be patient because, people have different personalities. You don't know what they've been through. And just you don't even know if they've been to sleep. And so you got to meet them where they're at. And the most important is getting that connection. You got to get people to be able to trust you. And the only way you can people trust you is how you approach them. Let them know that you really care, And another thing I've been telling people, you can give them money. Yeah, that's true. They like that. But at the end of the day, where did it get them? Did they get anything else out of your conversation? Like, did you get their name? Did you get any information how they got to this situation? Mm-hmm. Or is there any way that they can contact you or see you, or if they have questions and stuff like that? Would you be able to lead them to somewhere to get these information if you don't know?
Yeah.
So these would be the things that will be very, very helpful. So most important, I think the students should come to one of these groups and educate themselves by sitting in one of our groups, and there's a couple other groups too, not only just Street Voices. So like I said, come, and I think we did have some student come to the Dignity Center, and we did a little presentation for them. I don't know if this is the same group or not, but yeah. And we told them about homelessness, and then actually we had talked to one of the person that was experiencing homeless at the time. So I say more or less just get that connection, find the right people to ask questions, and don't be afraid to ask questions. Even you might feel uncomfortable asking them, ask them. Because them probably the question that you need to know to be able to help somebody.
That's great advice. Well, thank you so much, Sherry. Those are all my questions, but I know we all really appreciate you coming out and talking to us.